Today on our show, I'll be having a conversation with Dr. Bill Jackson, the COO of Virtual Dental Care, who has a product out in the teledentistry world that many of you probably have heard of, Teledentix. In fact, Bill has been at this company and been working on this product for a number of years. And actually, Bill and his partner are probably considered one of the pioneers in the field of teledentistry. On a personal note, I've known Bill for a number of years. I got into the dental market from the medical software market probably about 9, 10 years ago. And I think, Bill, we've about known each other that long. So I'm really looking forward to having this talk with
That's
you.
right.
And thanks for taking the time to be on my show today.
Well, of course, and thank you.
So I find it fascinating, your journey from where you were a number of years ago in your career to actually starting a teledentistry company. And I think it's worthwhile for our viewers to kind of understand where you came from in your experience, because it'll help them understand kind of where you are now with this new company. So why don't you just talk a little bit about your background?
Sure, I'll make it short. I'm a dentist by training, and almost out of dental school, I got involved in the insurance world. I'll fast forward a boring story. I ended up being a senior executive at some of the larger insurance companies out there. And when the dot-com world started up, I used those connections to start a company called Dental Connect. Merged with another company called Dental Exchange, founded by Richard Lee, who's been my business partner ever since. And we ended up selling that company to a consortium of insurance companies who wanted the technology that we had created. And upon selling that, we recognized that the internet was somehow going to be the future, and we started one of the first cloud-based practice management systems. The company was Planet DDS that we founded, and the software is called Denticon. Primarily in the DSO space, one of the biggest ones still out there now. We sold that company 4 or 5 years back at this point, and at that point, we had many years of technology development under our belts, knew the dental industry very
In fact,
well,
Bill, if I could
and
jump in.
wondered what was the next mountain. Sure.
If I could jump in, it was really interesting because I remember having a conversation with you after you and Richard sold the dental software company. And I was like, okay, great. You guys built up all this technology. What's next? And I remember you said, well, we're working on some things. And so obviously it led you to where you are now, right?
It did. We really felt, again, what problem can we solve in the dental industry that really needs solving? If we were to be so presumptuous that we could do that, but we had the background and deep industry knowledge, a lot of technology background behind us, and the biggest problem we saw was dealing with the underserved in the industry. 45% of the people don't have access to a dentist, and so we had some experience from our previous company with Paul Glassman, who's kind of known as the father of teledentistry. He was working at the time at the University of Pacific in San Francisco doing some studies on teledentistry. He needed an enterprise level cloud-based application, which Denticon certainly is. And he came to us and asked if we could work together. We needed to make some modifications. So we did start working with him, and just assumed, we didn't spend a lot of time with him, but we just assumed that Denticon was the right solution for teledentistry. So as we began to take a look at is there a solution to the underserved, and is teledentistry the right solution, we started working with a not-for-profit organization in Orange County, California called Healthy Smiles for Kids. Wonderful organization, see thousands of kids monthly. For free dentistry. They had a community outreach program. They were sending vans out to schools primarily to do screenings. And so one of the first things we suggested as we began to work with them was, maybe, you can use Denticon, you can use teledentistry and send hygienists out instead of these expensive vans. So we helped them put a program in place, and really early on realized that our software, as much as we loved it, was not the right software for that situation. It needed different workflows. There was a lot of things that made it, because of the fact it was designed for bricks and mortar setting, it made it not work for that situation. So we went back to our roots.
So Bill, I have a question for you. So because there's a lot of dental software out there and there's teledentistry out there, can you talk a little bit when you mentioned that the software you're going to use, the dental software, the practice management system, originally your thought was it could be used for teledentistry. Can you you mentioned workflows? Can you talk about just a few limitations so people can understand how teledentistry per se is a little bit different and why maybe some dental software might not work as well as a teledentistry solution?
Yeah, well, without jumping into the weeds and boring the heck out of
Sure.
you, but
Sure.
I mean, at the highest level, I would say it is that now this is going to be typically the model called virtual dental home is what Paul called it. Uh, this model was a hygienist going out to a remote location and with mobile equipment, and then doing preventive services, and then gathering diagnostic records. So handheld X-ray machine, intraoral camera, and so forth. Um, so to begin with, the workflow for the hygienist out in the field is not the same as the workflow of somebody working in a dental office. And the workflow, the needs of that, the needs of the work, I'm saying this poorly, the requirement is going to be dependent on the location that they go to, the requirements of the workflow. So if I go into a hospital, the workflow is going to be different than if I'm going to a school. If I'm going to a senior center, the workflow is going to be different than if I go to a hospital or a school. If I'm going into a skilled nursing facility, it's going to be different. So we needed to make it flexible. They needed forms out there, for example. Again, now I am getting into the weeds, but the forms that are needed, consent forms, et cetera, in a school could be different, literally school district by school district. The forms that you need for senior centers is completely different, skilled nursing facilities, et cetera, et cetera. So forms management needed to be dramatically different. Communication with the provider needed to be different. So in that model, again, typically they gather this diagnostic records, and then they inform the provider, the dentist provider, somehow that records need to be reviewed. So there's nothing in practice management systems that have that kind of communication capability. And even if the communication comes to me, what if a hygienist has gone out and done 15 patients, gathered records on 15 patients? So somebody's got to notify me who the 15 patients are. So even if I have access to Denticon, there's no report in Denticon that says these are the 15 patients waiting
Right.
for you. And as a provider, I don't typically go into practice management software anyway. And this is not just me, this is almost any dentist. So they now have to become practiced as to how to find 15 separate patients in that software. And then somebody has to go back in and see if the 15 records actually were reviewed. Were they not completed? So there had to be an audit process associated with it. Communication with the patient afterwards. Maybe 2/3 of them didn't need any further treatment, but 1/3 do. How do they get informed?
Right.
What is the workflow around that? So all
Kind
of
of
these things.
it kind of sounds, Bill, like a couple of things. First of all, normal dental software was almost like overkill for what you needed to do for mobile dentistry. It sounds like there was way too much in dental software. So you had to simplify it, number one, but number two, there were workflows that really were unsatisfied by the typical dental software. So you had to kind of create create different workflows. So it sounds like out of those needs, you actually created this product. The thing that fascinates me when I talk to you, and I've seen examples of Teledentix, is that I guess because of your experience and Richard's experience with dental software, you're very unique in that you've created an EHR within the teledentistry solution. You don't see that very often. And so I was wondering if you can talk a little bit about why you wanted to put in the EHR. And then secondly, you and I talked about a fascinating project you've worked on with a medical partner that kind of brings in clinical documentation to EHR. So I'd like to explore your EHR a little bit so folks understand that it is possible to actually have good clinical documentation within a teledentistry solution.
Well, yeah, and we had never intended to replace, as you said, it's a very simplified, what needs to be done in that particular scenario is it doesn't have to be a full-blown EHR or EDR in the dental world. So but they do need to have something out in the field. So, they couldn't be using bricks and mortar software. It's just, again, it didn't work. The flows, for all the reasons I just said, didn't work the right way and so forth. So we did create a very minor, but very usable EHR. Our intent all along, and we've done this now with a couple of different practice management systems, was to integrate. So the data that was gathered out in the field into the EDR could be sent back into the practice management system. So for a dental office, they don't have to have their data into location sent. Again, we were never intended to be a replacement for the dental practice management system. So what we've done is it literally sits on top of the typical dental practice management system. And I'll talk about that in a second when I get back to your question on medical. Now, there were two other components that are very important here too. If I'm going to 20 different locations, let's say I have 20 clients that I'm going out to their locations, the needs of each of those clients, as I touched on, could be completely different. The way to schedule the patients at those locations is a challenge. Again, traditional dental office software doesn't have that capability. So if there's customers that we have now that go out to employer groups, for example, doing that exact same model. So if one of our clients goes to the Facebook campus where there's 17,000 employees, they all need to schedule appointments at 7 different locations. They may be mobile, but at 7 different locations on that campus. And these are very highly sophisticated employees. They are not low-level users of the internet. So,
Can imagine.
So it had to be really high patient touch. But I mean, again, this just grew out of the fact that if you're going to senior homes, maybe you make appointments. If you're going to schools, maybe you don't. But we built that all in. So that's one component. Another component that was very important is the ability to refer. But we started working with a medical group, a telehealth group that is doing remote patient management for cardiologists. And so to change from what we had to in dental to support the cardiologist group was not very difficult. They need to see certain things. They need to be tied to certain devices. But the flow is the same. They still have to engage with their patients and share records. They still have to collaborate outside their own small telehealth company. So all of the things that we had were certainly applicable. All we really had to change were the modules within the EHR that were specific to dentists, change them out for things that are specific to a cardiologist. And we can go into any other vertical similarly.
Well, and that's the point. You and I have talked about that in the past, about if you have an EHR, templated EHR, that's 90% of the battle. To make that a specialty type or to change whatever type of provider in EHR, once you have a strong EHR, it's just really the content. It's for a cardiologist, for a neurosurgeon. It's just different content, right, with EHR. So that's really important. You had mentioned, you talked about collaboration a little bit, about with specialists, with the patient itself. And you kind of look at collaboration, I feel, a little bit uniquely in how put it together. And I was wondering if you can talk a little bit about how you do collaboration and kind of your processes and your workflows within collaboration with other providers and including the patient, for example, in your solution.
In the initial design of our platform, we recognized the importance of this. And so we were really kind of scratching our head as to how do you design this? There's lots of ways to transfer records, right? And there's lots of ways to do that securely and so forth. And plenty of that stuff's already out there in the world. But we wanted it to be more. We wanted something more than just sending records. And so we were looking around, and right under our nose, of course, is social media networks, right? So, that's exactly what they do. They're collaboration. They are, I can do one-on-one collaboration with you through LinkedIn, or I can create a group and invite you to a group. And so we modeled it after social media networks, really. And so think of a secure LinkedIn, if you will. So I can invite hundreds, thousands of other healthcare providers into my network. So, and that can be, and in fact, we invite cross-disciplinary collaboration there. So I can invite physicians in, I can invite chiropractors in, I can invite podiatrists in. Again, I don't know how this all relates, but we didn't want to limit it. We didn't want to say, well, a dentist is never going to talk to a podiatrist. Well, we don't care. Maybe there is something there, but the point being is I can bring as many people into my network as I want, and then I can create groups within that network. So, for instance, maybe I have a study group. I'm a periodontist, and I have a study group of all of my referring dentists. So I created a group for that. So if I have an interesting case, maybe I post it. In the old days, that was a study club. Right now,
Right.
it is. I'll just put it up there, and maybe I'll put a video up explaining myself beforehand. I'll put the patient records up. Maybe I'll even interview the patient and put that up onto into the discussion. So everybody in the group is then notified that this is out there. So you can think about this as across interdisciplinary issues too. So I'll put out to my whatever group I choose and maybe if I'm a pediatric dentist, a pediatrician's involved in that group. But I'll put a case out there, or I'll put the records out and share. They can come in and get them, or I can request records from somebody else via this mechanism too. So again, it's collaboration, it's sharing of records. Patient has access to the same thing. Whenever my records as a patient are shared to some other professional, I get notified, and I can go in and see who's seeing them and what records they saw. And
Well,
so
and that leads into the idea of that we've talked about before. It's called like the medical home in medicine, which is, I guess, the virtual dental home, which is the patient should be, in fact, it should be patient centric, right? The patient is the center of all this. So they should share in the information. They should help their providers make decisions with the information. And, but it's interesting how you've simplified, again, I guess with your experience with social media and looking at that, how you simplified the collaboration process.
well, and getting back to, you had mentioned, we were talking earlier, and you mentioned, yeah, there's a lot of patient engagement kind of stuff out there,
Right.
and anybody in the telehealth world to say we engage with patients. To, to us, that is such the tip of the iceberg. We call it patient participation as opposed to patient engagement.
Hmm.
We want to bring the patient, and this is in the overall health world, not just dental. We want to bring the patient into the process. We want to give them easy means to communicate with their providers, and again, multiple providers, maybe cross-disciplinary providers. Maybe it's video, maybe it's chat, maybe it's text, maybe it's email, and all of that stuff needs to be in one location and always put into one common record so that everybody sees all the communications that are going on. It's not just one-offs. So
Right.
it really is patient participation, much more than just patient engagement.
The other thing I found interesting about a lot of your clients is when people think of teledentistry, right? At least at this point in time, they think about provider to patient in maybe a home setting, right? Because of COVID, for example. But you do a lot of work with employers and insurance companies that work with those employers. Can you talk a little bit about that area and that market and some of the work you've done with companies like you had mentioned, Facebook, for example? Talk a little bit more about that area that you guys have an expertise in.
Sure, and those clients are not our clients. Our clients are the ones who are delivering the care. So we
Okay.
supply the software, and their needs are very unique. So a lot of our development over the last 4 years has been to meet the unique needs of the people that are going to employer groups. So yes, that's an industry that exploded over the last 2 to 3 years, in my opinion. We call them TSOs for the ones that are doing the so-called pop-ups, meaning
Have you trademarked
teledentistry
that? Have you
support.
trademarked TSO yet?
No, we want everybody using it, so we don't want to limit the use. But if you go to our site, you can. I've written a paper about it. But anyway, the idea is employers love it because of the fact that they don't lose an employee for a half a day, especially in crowded cities and so forth, to have their X-rays and exam. Employees love it, and uh, you know, thousands of patients a day were being treated by our clients, and so all of that was going into our system. So we had lots of users, lots of people banging on it. It wasn't that it was typically though this asynchronous model where the records were reviewed later. They weren't done on a real-time basis. We had built a synchronous component into the software platform, but it was not something that people were using a lot of. But nonetheless, it's a very interesting model, and the insurance companies like it and are offering it now to their clients. Again via the clients that work for us, or we work for, but the clients that use our software are who the insurance companies are dealing with. But we're closely working with the insurance companies too, because of the fact is this front end, this ability to schedule an appointment, to fill out the forms, to register, and so forth. They like the idea of that going through their own portals, and then it opens into essentially our application where the patient can make an appointment, can fill out their forms, etc.
The other thing you had showed me at one point when we were demoing the software was, and I guess it's along with the employer talk we're having right now, is the idea of campaigns, where for employer, if they have certain campaigns for certain types of products or services, it becomes very easy to do that. Can you talk a little bit about kind of how you set those up, the whole concept of setting up campaigns behind the scene for some of the employers?
Yeah, or any location that somebody is going to, but absolutely.
Yep.
And in fact, we do it by location. So um, I won't bore you with one story, but I can tell you how one dentist we were working with got 24 new patients in less than a half an hour through these campaigns. But
Hmm.
I'll come back to that in a second. So the idea is campaigns, or we call them packages. But at any rate, we to make an appointment, we make it very easy to create a landing page. Essentially, we call them microsites. So that if I'm going out to an employer group, let me give an example. I'm going out to an employer group. We send an email out beforehand that says on such and such a day, the pop-up clinic is going to be on site. You know, click here to book an appointment, or click here to register, whatever. But let's say click here to book an appointment. So they'll click on the book an appointment. Again, this is what our clients requested, so we built this in, and that is maybe there's going to be 3 treatment packages offered, or 4 treatment packages offered to those employees. Maybe one is just cleaning and exam. Maybe one is cleaning, exam, and whitening. Maybe one is clear aligner scan. You know, you can just make them up. You know, I mean, you can in your own mind as to what treatment
Right.
packages you want. And that's going to define what the duration of the appointment is going to be, which is built into the appointment scheduling software, and it's also going to determine what the fee will be. Now, if it's all insurance and there's no fees, then it's 0, and that's fine. If there is a fee required, we have the capability of requiring a credit card to be paid up front prior to the appointment. So we've all built that in. But again, we can create these packages, and in the future, we're seeing it already. But in the future, maybe that package is for me as a solo dentist at my dental office. Maybe it is virtual denture consult. Maybe it is virtual clear aligner consults. Maybe it is virtual cosmetic dentistry consult, whatever it might be. But I can create all of these packages, put a different time duration on it, put a $ if I want, and then that'll take the patient through the flow
So,
as they go ahead.
so since you mentioned future, that's a good segue into what I want to talk about next. So, since I have you on the hook here on the podcast, and since you're somewhat of a pioneer in the industry, I kind of like to go past where we are now with COVID, right? Where a lot of people think teledentistry is for COVID, and talk a little bit about the future. So, when you look at how teledentistry or virtual care will be incorporated into dentistry over the next few years, what are some of the things you think will be happening? Features, functionality, things that people will be using that maybe aren't on the radar right now will definitely be an important part of a total dental solution in the future.
Well, I'm going to beat on the same drum. It's going to be this patient participation, tying in patient participation and collaboration. So you can get very creative around those ideas. Here is one example. I talk about clear aligners, and I've talked about this to a number of people already too. And that is let's say with clear aligners, I could be having a video. You're interested. We set up an appointment for you and I to talk for the first time. So we're talking and you have questions about aligners. So we've got a 15-minute appointment. We talk, maybe I ask you to take some pictures of your mouth and while I'm sitting here watching, and you can send them to me, maybe not, that's fine. We bring them up on the screen. I say, you look like you'd be a good candidate for this. Let me take a look at these records, and we'll send you something within the next 24 hours, and I'll give you my thoughts on it. So you've had, less than 10-minute appointment with me. Maybe I gave it to you for free. Maybe I charged you $20, whatever the thing might be. So that's step one. And you haven't left your house. And this has been very easy. You've gotten to know me. Maybe you liked me. Maybe you didn't like me. But so that's step one. Step two is then I take a look at the whatever it is that I saw. If it's clear liners, maybe I say, yeah, this is really simple. But then I go back in and I make a video recording. This is all capabilities in our software.
Sure.
I'll go in and make a recording, and I'll say, Um, I've taken a look at it. I think you're an excellent candidate for clear aligners. I'm going to suggest 24 trays over 16 months with it. And, and the cost is going to be this. And I put that in a video. I share that securely through your patient portal, you at your convenience now. And I've done that at my convenience. Maybe I did it at night, so it didn't stop the rest of my day. So now you at your convenience take a look at it and you go, okay, well, this is good. And then embedded in there is maybe a video about clear aligners. Maybe there's some papers about clear aligners. Maybe there's some before and after pictures of other cases I've done that are similar. Then maybe you set up another appointment to ask more questions. But by the time you come into the office, you're sold. I mean, you're not going to come in on accident now. You're coming in because you really want the treatment to get started or whatever. And, you could say the same for dentures. I could say the same for, again, cosmetic treatments. I could say the same for implants. So there's any number of opportunities there where I'm engaging the patients and the patient is participating in his or her treatment decision on a completely different level than was available before. So there's
Right.
one example.
And it goes really into being an informed patient at the end of the day, right? Like you said, once they come in, they're ready to do the procedure, do the treatment, do whatever, because they've had the time, right? By working with you when they were at home, they have time to think, they can see everything, they're not on the spot, and they can make a more informed decision. So,
Yeah.
I'm
And
really,
in this post-COVID world, I've kept that patient out of the office. I didn't have to have the patient in the office for
and
2 or
that's
3
another benefit
appointments.
right now. So what I'm looking forward to, there's going to be so many use cases, and you folks are on the cutting edge of a lot of this. So I really look forward to doing some more of these as more use cases and more features and functionality come out. I definitely look forward to talking to you again. And I really appreciate you taking the time today. If folks want to find out more about virtual dental care, your product Teledentix, or even communicate with you, what's the best way they could get in touch with you or your company?
Well, the company, go to the website, and there's certainly contact us info there. Personally, I'm simply B Jackson, as in Bill, B Jackson at virtualdentalcare.com.
Great. Well, thanks again, Bill. And I look forward to talking to you as the industry evolves further.
Yeah, a lot of fun.